So in this video, I'm going to be talking about sterile gloves. Now, remember that the difference between your clean gloves and your sterile gloves is the protection. So with the clean gloves that are open boxes, open to dust and debris in the room, getting inside of those boxes and carrying microorganisms in, those gloves are just intended to protect us, that are the healthcare provider treating the patient. The clean gloves do not protect the patient. They are not much cleaner than my regular hands. Sterile gloves, on the other hand, are meant to protect not just myself, but also my patient. These come in special sterile packaging so that they're free of microorganisms when I open this package. So these come in different sizes than regular gloves. The regular clean gloves just come in extra small, small, medium, large, extra large. The sterile gloves come in number sizes, kind of similar to shoe sizes. So like this one here I have is a 7.5, which isn't my perfect fit, but will do for this video. So what I want to do is open up this package and maintain the sterility of the package as I open it up. So if my fingers will work. I'm going to open this package up. And the gloves are contained inside of this paper here. So we can see, I'm gonna lift this up and show you how the gloves are come packaged. Now I'm going to open this up, and if you notice in your video, we have a left hand and a right hand. So this tells me exactly which glove and where it's at is meant for which hand. So all I have to do is turn this around, and also notice here this 1-inch border. Whenever we're working with sterile items or sterile fields, we have a 1-inch border of what we consider to be unsterile. So the 1-inch border is what I'm allowed to touch. I cannot touch anything within that 1-inch border though, because that is to keep sterility. Now, as I'm standing here, I also want to make sure that everything maintains above waist level to maintain sterility. And then also, I should not talk over it so that I don't get any droplet infection onto the sterile area as well. Now I'm going to open this up again just by touching that 1-inch margin, 1-inch border. Try to get it to stay put. It can be a little tricky. And again, I don't want to touch outside of that 1-inch border. This again was my left hand. So now everything that's in here is sterile. But if you notice, the way that they folded the glove over is that the inside of the glove is actually sticking out for me partially. So that way I can touch it to put it on, because the inside is going to be touching my skin anyway. And so I'm still not contaminating the outside of the glove. So I'm going to pick it up here where it's the inside part only that I'm touching. And then I'm going to slip my hand in. This can be a little bit trickier than it looks, or just as tricky as it looks, depending on how well I do this video. Okay, so now that glove is on. How do I get this one on? Well, this one's sterile. I've not touched it. This glove is also sterile. So I can just use this hand, go under the glove like this, take my other hand, again, I'm only touching the inside, and slip my hand in and pull up and over. And there we go. Now I have my sterile gloves on. And again, to remove my gloves, I grab from the inside, pull down, under, over, everything's inside in a nice little ball. Thanks, guys.